So children, today we'll be starting with chapter 32 of Apurba Sastry Essentials of Microbiology, which is Miscellaneous Bacterial Bloodstream Infections. So first starting with brucellosis, then we'll be covering leptospirosis and borreliosis. So brucellosis. Brucella is an obligate aerobic fastidious small gram-negative coccobacillus responsible for highly contagious febrile illness called brucellosis. Brucellosis, also called undulant fever, is primarily a zoonotic disease affecting various domestic animals such as sheep, goat, or cattle. Human infection is usually associated with occupational or domestic exposure to infected animals or their products. History. Brucella was named after British Army physician Sir David Bruce, who isolated the first recognized species, Brucella melitans. Melita is Roman name for Malta, from Malta Island, Europe, hence the disease was called Malta fever. Norman system of classification. Brucella belongs to family Brucellaceae. DNA hybridization studies reveal that the members of the genus Brucella are very closely related and probably represent variants of a single species. However, for the sake of convenience, these have been classified into nomen species based on various properties discussed under laboratory conditions. Nomen species. Important nomen species associated with human infections are as follows. Brucella melitans. It is usually pathogenic to sheep, goat, and camel. Man is also a susceptible host. Brucella abortus. The infection is acquired from cattle and buffalo. Brucella suis. It infects most often pigs. Brucella canis. It causes abortion in dogs. Occasional cases of human infection have been reported. Antigenic structure. Brucella have two major types of lipopolysaccharides, antigen designed as M and A. They are present in varying proportion on three major species of Brucella. However, one of them is predominant in each species. In most biovars of Brucellosis melitans, M antigen is predominant. In most B abortus biovars, A antigen is predominant, and in B suis biovars contain either M or A antigen. Pathogenesis. Brucellosis melitans is the most pathogenic species, followed by Brucella abortus and then suis. Human infection with other species is extremely rare. Transmission. Brucellosis is zoonotic, transmitted from infected animals to man by various modes. Direct contact. Most common route is direct contact of abraded skin or mucosa with the infected animal tissue, blood, urine, vaginal discharge, or placenta. Foodborne. By ingestion of unpasteurized milk or dairy products or uncooked meat from infected animals, or rarely vegetables, or water contaminated with animal excreta. Airborne. By inhalation of dust or aerosols in the infected cowshed or slaughterhouses. Person to person spread. It is extremely rare, though breast milk or by tissue transplantation or blood transfusions. Spread. From the initial site of infection, the organism spread to bloodstream, resulting in bacteremia and then disseminate to involve various organs. Organs involved. Brucella primarily affect organs of reticular endothelial system such as lymph nodes, spleen, liver, and bone marrow. Other organs such as placenta, musculoskeletal tissues, and genitourinary systems are also involved. Local tissue response. Initially, neutrophilic infiltration occurs, which is later on replaced by chronic inflammatory cells, leading to granuloma formation. Intracellular survival. Brucella are facultative intracellular pathogen, infect macrophages and monocytes. The cell wall lipopolysaccharide appears to be the major virulence factor, plays a key role in the intracellular survival. Host immune response. Cell mediated immunity CMI is the key to control the infection. Th1 cells produce interferon gamma, which cause macrophage activation, leading to killing of intracellular organisms. Antibodies play only a minor role as they are active only in extracellular milieu. Clinical manifestations. The incubation period varies from 1 week to several months, and the onset is either abrupt or more often insidious. Classical triad. Though the manifestations vary, the classical triad of fever with profuse night sweats, arthralgia, arthritis, and hepatosplenomegaly are present in most patients. Foul-smelling perspiration is considered as a classical sign but uncommon. Typhoid-like illness. Overall, brucellosis resembles typhoid-like illness except that it is less acute, less severe, with undulating pattern of fever and more musculoskeletal symptoms. Undulating fever. Fever has a typical remittent course, that is in between febrile period, which lasts for weeks. There will be afebrile period. It is also called Malta fever or Mediterranean fever. Musculoskeletal symptoms are present in about one half of all patients, which may mimic skeletal tuberculosis. Vertebral osteomyelitis involves lumbar and low thoracic vertebrae commonly. Septic arthritis. Most commonly affected joints are knee, hip, sacroiliac, and shoulder joints. Other non-specific symptoms. These include abdominal pain, headache, diarrhea, rash, weakness, fatigue, weight loss, vomiting, cough, pharyngitis, and refusal to eat in children. CNS. Depression and lethargy with meningitis or lymphocytic meningoencephalitis are the most common neurological manifestations. CVS. Rarely causes endocarditis affecting the aortic valve. Sanitary manifestations include acute epididymoorchitis, prostatitis, salpingitis, and pyelonephritis. Epidemiology. Brucellosis is a worldwide zoonotic disease. The occurrence of in humans is closely related to prevalence in various domestic animals. Endemic area. Human brucellosis is endemic in areas where animals are raised in large numbers, such as countries of Mediterranean zone, Eastern Europe, Central Asia, Mexico, and South America. The disease is rare in most European countries, Australia, and North America. Prevalence. The true prevalence of human brucellosis is difficult to estimate. Many cases are underreported either because they are inapparent or due to difficulty in diagnosis. Source of infection are infected animals excreting the organisms in urine, milk, placenta, or vaginal discharge. Contaminated animal food products such as dairy products, especially soft cheeses, milk, ice cream, and rarely raw meats and bone marrows. Occupational risk. Farmers, shepherds, goat herds, butchers, abattoir workers, veterinarians, laboratory workers, and in endemic areas are at high risk of occupational exposure to brucellosis. Laboratory diagnosis. Specimens. Blood, bone marrow, etc. Blood culture by Castenda's biphasic media, BHI broth or agar. Automated techniques such as BACTIC or BACT or alert. Culture smear motility testing reveals non-motile gram-negative cocobacilli. Identification by automated identification systems such as MALDI-TOF or VITEC or by conventional biochemical test. Serological test, antibody detection, standard agglutination test SAT detects IgM. The test to detect IgG antibody, 2ME test, ELISA. Molecular method, PCR detecting RRS, RRL gene, OMP2 gene. Protein, BCSP31 and IS711 insertion sequence. Laboratory diagnosis, culture. Brucella are recovered from blood, bone marrow, CSF, joint, fluid, or other tissues. Blood should be collected aseptically during the febrile period before starting antibiotics. Multiple blood cultures, 8 to 10 ml per bottle, 2-3 times a day, over 3 consecutive days, yield better result. Bone marrow culture remains positive even after starting antibiotics and gives a higher yield than blood culture. Biosafety precautions. As Brucella is a highly infectious pathogen, all laboratory procedures should be carried out with adequate biosafety precautions. Culture condition. They are obligate aerobes, but growth is promoted in the presence of 5 to 10% CO2. Primary isolation requires prolonged several week incubation at 37 degrees Celsius. Blood culture. Automated blood culture such as BACT or alert takes lesser time for isolation, 7 to 10 days, and have better recovery rates. Therefore, they are preferred over conventional blood culture media, Castenda's biphasic media with brain heart infusion, BHI broth or agar. Okay, now, so this is blood culture bottle, biphasic medium. And in the figure B, you can see BACT or alert. And third figure shows gram stained smear of Brucella species showing small gram negative cocobacilli. Subcultures are made from positively flagged blood culture bottles onto blood agar and then incubated in candle jar at 37 degrees Celsius overnight. In blood agar, colonies are small, smooth, transparent, and non-hemolytic. Culture smear and motility testing. Gram staining of colonies reveals non-capsulated small gram-negative cocobacilli. Brucella are non-motile by hanging dot test. Identification. Identification of Brucella from colonies is made either by automated identification systems such as MALDI-TOF or VITEC or by conventional biochemical test as given below. Brucella is catalase and oxidase positive. Urease test is rapidly positive for Brucellosis suis and Brucellosis canis. Norman species of identification. The Norman species are identified based on the following test: preference of animal host, CO2 requirement and H2S production, tolerance to bacteriostatic dyes such as basic fuchsin and thionine, agglutination with specific antisera, lysis by bacteriophages. A standard reference strain of Tibicely phage is used for phage typing. Serological test, antibody detection. As anti-isolation is difficult, serological tests are of paramount importance in diagnosis of brucellosis. Several tests have been developed such as standard agglutination test and ELISA. Standard agglutination test SAT. SAT is considered as the gold standard serological test procedure. It is a tube agglutination test. It detects antibodies against lipopolysaccharide antigen of Brucellosis abortus. Serial dilutions of patient sera are mixed with killed suspensions of Brucellosis abortus and incubated at 37 degrees Celsius for 48 hours. Positive test. The diagnostic cutoff for titer depends on the disease endemicity. In non-endemic areas, a titer of more than 1 is to 160 along with compatible clinical manifestation is considered significant. In endemic area or following occupational exposure, titer of more than 1 is to 320 or rising titer by repeating the test after 2 to 4 weeks is considered diagnostic. Interpretation. A positive SAT results indicate either acute or chronic brucellosis. As SAT detects total antibodies IgM plus IgG, it cannot differentiate between acute and chronic infection. 2 mercaptoethanol 2-ME SAT test. 2-ME destroys IgM antibodies, therefore SAT performed with 2-ME treated serum detects only IgG and confirms chronic brucellosis. SAT positive and 2-ME SAT negative indicates acute brucellosis IgM. SAT positive and 2-ME SAT positive indicates chronic brucellosis IgG. Okay, so SAT positive and 2-ME SAT negative indicates chronic brucellosis IgM. SAT positive and 2-ME SAT positive indicate chronic brucellosis IgG. False negative SAT may occur due to prozone phenomena due to excess of antibodies in patient sera or presence of blocking or non-agglutinating antibodies. False positive SAT may become false positive in infection with other gram-negative bacteria having similar lipopolysaccharide antigen. So, other antibody detection test. ELISA is highly sensitive test. It uses either cytoplasmic proteins or lipopolysaccharide antigen to detect IgM, IgG, IgA antibodies individually. Therefore, it is useful for diagnosis of chronic brucellosis. However, the result has to be confirmed by SAT. ELISA is also useful in diagnosis neurobrucellosis. Dipstick assays for anti-brucella IgM are available for diagnosis of acute infection but is less sensitive. Molecular method. PCR assay using primer for 16S to 23S RNA operon, RRS, RRL gene, OMP2 gene, outer membrane protein, insertion sequence IS711 and protein BCSP31 are available. It is rapid, sensitive and specific and can also differentiate between the species and biomass. Blood and tissues are ideal samples for PCR assays. Film Array Biothreat Panel is an automated multiplex PCR useful for simultaneous detection of 17 human pathogens causing bioterrorism, including Brucella. Diagnosis of brucellosis in animals. Brucellosis is diagnosed in animals by various methods such as milk ring test, Rose Bengal card test, detecting antibodies in infected milk. Now comes the treatment. Various regimes are recommended for the treatment of brucellosis. Standard regime in adults: gentamicin for 7 days plus doxycycline for 6 weeks. Streptomycin can be given alternative to gentamicin. WHO regime in adults: rifampin for 6 weeks plus doxycycline for 6 weeks. Relapse or treatment failure occurs in 5 to 10% of the cases. For CNS involvement, ceftriaxone is added to the regime and treatment is prolonged for 3 to 6 months. Prevention. Prevention in animals. The most rational approach to control human brucellosis is to control and eradicate infection from its animal reservoirs. Test and slaughter. Active case finding is done and infected animals are slaughtered. Vaccine. Live attenuated vaccine using Brucellosis abortus 19 strain for cattle and Brucellosis melentis rev 1 strain for sheep and goat are available. Prevention in humans. General precautions such as use of pasteurized milk or properly cooked food, use of protective measures to prevent direct contact with animals. Vaccine. Live attenuated Brucellosis abortus 19BA is available for human use but provides short-term protection and has shown high reactogenicity. Okay, so this completes our brucellosis. Next we will be covering the spirochetal infections in the next video. Okay, so keep studying and thanks for watching. Like, share, subscribe.